morning. It's still morning here. We're in Phoenix. I get like the last aspect of the day. You know, I would have one more jump if we got to Hawaii, but it's already tomorrow in Australia, right? I wanted to talk about what they say is neurostorms. Kids that supposedly cry due to neurological reasons. I've had one of those children, you know. There are times where when Graham, approximately 2 years of age, when fluid started to build up in his lungs, because my son was dying, you know. It was a slow process, but my son had Haemophilus influenza and staph undiagnosed, right? And so there's lots of people that come in here and immediately it's like, oh, they cry because it's neurological. I want to really stop that. There's a post, and my post, and I'm going to talk a little bit about laryngomalacia. So I'm not a doctor by any means. I'm a movement specialist. I've gone probably to 13 some countries with this work. Some very repetitively, like up into South Africa 5 times, UK, Vienna, Russia a couple of times, India 7 or 8 times. Savitri will correct me because she always does. Bhutan twice. I travel as much as I can, or did, and now I can't travel. So now you get me on YouTube or lives. So first of all, how do we rule out pain-based? Now, the biggest pain-based, especially if it's upper respiratory sinus. Now, you have eustachian tubes that can build up. You have your frontal sinuses. Then it goes to your sphenoid sinuses behind the eyes. So if you get those hound dogs, this is with my Graham, because his sphenoid sinuses were so impacted that it then, quote, he got his CVI from that. And I don't mean quote, but my son had structural issues that then became psychological issues. The apnoid relationship is almost back of your zygomatic, going into your zygomatic arches is your apnoid. Again, depending on your head shape, so it's not as far back with your ears. You have your ear canals, you have eustachian tubes. There's a lot of tunnels, canals that go on. What do? They house your sinuses. The frontal sinuses are meant to make your mucus, and it comes down through. A mucosal flow rate is more fluid to an infant, let's say to toddler. Like right now, I'm not talking to you with drool and snot, but you will have that for under a year of age. And then once a teething process, it needs more saliva. Why? Because when your mouth is open more, which I didn't know, 5 dental surgeries later, you will dry out your saliva and that will rot the teeth and having complications there. So part of the reasons are that you have that extra saliva because you're producing a full set of teeth within 2 years, and you need to coat that. But also what happens is I believe that's why tummy time and such are so important, because you're neuro mapping based off of your saliva going around. My son literally was screaming 2 days straight, and I'd taken him to the hospital. I didn't take my son to the hospital because he had a splinter. You know what I mean? I used it. I always looked at the ER like 911 if I could problem solve it. And also, too many germs there. And I also wasn't getting help. And it was getting a little bit old. My son he was screaming for 2 days straight. What is the first thing she tells me? We don't treat fussy babies. So already and I'm like, my child's not fussy. So much so they finally, again, not trying to diagnose him, but again, what did I know? That he had a massive panniculitis, which went into preseptal cellulitis. That was 11 days in the hospital. That he was impacted. He had impacted sinuses. He didn't have a sinus infection. He literally, and so they even gave him clonidine, and clonidine made him psychotic. Clonidine is supposed to, in a sense, sort of like a Benadryl, just knock you out. But again, why am I knocking my son out when my son is dying from an infection? So now, or lately, you know how many people have said when they hear that he had Haemophilus influenza, let's say in staph for 3 years, do you know how much pain he was in? No, I had no idea. There were times I just shouldn't have been driving. I was just sleepless. So, where's the point of my story? First of all, I've been where you've been. I really have. I get it. There's always a case more severe. There's always a case less severe. Every child and you need the help you deserve. Okay, that's first of all. If you are with someone, including me, and you don't feel that you're getting the help that you deserve for your situation, you're just going to have to get another opinion, right? And I'm not talking about necessarily, because for every opinion you're going to get an answer, and now you've got to sort through that as well, but you need a second opinion. So what's the first thing we rule out? We have stress of upper. When you go from a vertical position to a horizontal, usually because you're putting pressure into the cranial. This is why I'm doing cranial movements, because of what I've learned from my son and the courses that I'm teaching. But up until 18 months, the fontanelles and everything, sutures haven't even closed. And the fusing doesn't stop till age 20. This is why when you and I have an ear infection, it's not as hard on us versus a Munchkin. Because what happens is the skull is still soft tissue. It's not calcified. It's closed, but now your skull's growing, right? It's still more of a living organism. And so when you put that pressure on a kid, right, and this is, or in their ear, it's like, So now they have... morning, corn. So now they have that situation. So if you're going from a vertical situation to a horizontal, or a horizontal situation to a vertical, and you have a different child. So for the comment was, if I pick them up, and that's usually what is the case, if I pick them up and hold them, they're okay. So what people start associating with is they want mommy time or daddy time, right? But of course they do, because I can finally breathe in this position. I don't hurt as much. It's just like, and also that's what you're getting but again, now, the reason, so sinuses impacted go down, usually it's much worse. This is where kids are worse even with sickness at nighttime than they are during the day because of that lying down. There were times too, Graham just had to sleep in a car seat. And I had no idea. Because that gave him the relief. But he couldn't move. Car seat's probably one of the worst things if you want functional pelvic movement. It just doesn't happen. You can't do anything at a 33-degree angle, especially something like swallow, which somebody like Corn's son has to take into account because he has a trach. So now there's structural stuff, right, that a child not only didn't plan for, but it's not like I can scratch at 8 months old underneath my trach tie. So in the case, you might have a rappel, but really they're trying to get away from the pain or discomfort, which are the same for a baby. If a baby's uncomfortable doing something, they won't do it. And it's not the difference between, if I do that, it hurts. It's the same if it's uncomfortable, it hurts them. If they know that they're going into some kind of transition and it causes discomfort, they're done, right? So now what we're looking at too is if you start seeing structural changes. So up here, especially going forward, I have more head control and I can talk, but back here, I have post-nasal drip going down. I might have a bit of a high palate. My adenoids now are a little bit enlarged, which you can't have that combination when the palate is high. Why? Because now I'm getting literally like, have you ever been in an ocean and that wave hits you, or you go in a pool and you're like, it gets up in your nose and stuff? That's what the kids are feeling like. You put them in a certain position. Are you getting now a back archer? They're fine here because, again, it keeps the valve and the esophagus open, right? But back here, they're starting to arch and do those kind of things. These are what you start looking at. Are they fussier in certain positions? Do they act like they're coming up for air, like they've been underwater? Are you hearing their breathing? Like Pierce, he had scar tissue in his vocal cords from intubation. So he can only, the high notes he could get out, but he couldn't babble. But when he was here, what I said immediately, he had to go ear, nose, and throat because he snorked. You should not hear any kind of respiratory with your child unless you know that they are at that moment sick. Or what I call puppy pants, when they get excited, that around 8 months of age. Other than that, but I'm talking about respiratory, you should not hear. So when you're finding environmental structure changes, or where they literally have to change their structure in certain positions, meaning, well, when they're here, they're, quote, nice and loose, but here, and so my doctor says, or whatever says, they're mixed tone, and kids don't cry. They'll cry because they miss you. They'll cry because I get that. I'm talking about that cry where you suddenly become desperate as a parent. When they're crying and you're just like, I know I should go to the hospital. Like my son had Haemophilus influenza for 3 years. There were times, again, that he was getting vegetative. And literally he'd just be like, he could sit, lie down, and fall asleep. He was that. There was one time he's laying there and he could barely do this in the car, and just the drools coming out of him. And his OT was like, oh, he's stimming. Sorry, he's starting to stim. And I'm like, he is exhausted. He's not sleeping through the night. He is exhausted. I'm exhausted. This is all he can muster up. My first sign of Graham's intelligent, other than a girlfriend at 4 saying, oh, he's really smart. I'm like, he can't even say mom. And she taught me a lot, because you hear it here. Like I was just telling, Melissa was just talking, we were talking about yesterday, we did a little live with her. Vision came in from Dr. Cassidy, who I work with, or who sees a lot of my clients. And she had like 7 visual diagnoses. I knew immediately when I saw her. It's a year post-trauma with her accident, and she needed help with her vision. So she's getting glasses and she's getting all that, because the main thing that she has too is exotropia, where the eye wants to come out. And so the live is yesterday that you saw with that. But again, the lack of head control, of trying to find the vision and all of that. These are things to come in. So the first time, and I said to her, that's what I was saying she's so smart. And it helps parents to know that. But again, what I see is, if a child's doing all of that with what they've got, we've got a really smart kid here that we have to help every child. But I'm just saying, she just wants to sit up again, but she can't so much as see. But boy, you put beads near her or something, she goes right to it. So there's a lot of nice play skills that need to be drawn out and enhanced, so we can start bumping the movement up and the cognitive. That's another thing I want to say, guys. You can't, if you don't have the movement, you're not going to get the cognitive bump. All of our movements come way before we start talking. All of our movements come way before we start going into the social aspect of things, right? Our movements are majority of our vocal. Now, we can't master them. Master means that, like I'm doing, I'm teaching you. I'm a master at certain movements because I'm able to articulate and teach you these skills. That's it. It's the only difference between me and most people. Most people know how to do everything. But if you don't know how to now teach it, right, that to me is a master's level. Otherwise, again, you're playing with immature to mature movements, but that doesn't mean you're a master. So these are things that you need to take in consideration. If your child, in a sense, is screaming, they're screaming for help. If someone is telling you that's just because they have neurological issues, that alone, if someone is not helping you, take that extra step to help your child, and their only solution is to possibly drug them enough so they can't respond to that pain. And now I get it. We needed to get Graham out of pain, but we also needed to keep going. The only solution with him is getting him out of pain. And there was no solution to the problem. And it's funny, because now I go back and I say, well, Graham's history, and doctors will, there's no way this kid could have had, and I'm like, don't even get me started. He had Haemophilus influenza for 3 years. And 14 had surgeries and only 1 went for culture. Don't even get me started. But, so and I'm not here to do a Graham story. I'm just saying I've been through this. I wish I had me. People go, oh my gosh, I'm doing all of this, guys. Like I would have, every video that I've done, you should have been through all of them. There's so much gold in all these videos. So please just take at least one video a day and try it with your child. But really, if you're not getting the help that you need, you deserve it. There's no reason. Kids with special needs are the sweetest kids. Kids with special needs don't bang their heads. I have another topic that I just did on head banging. Kids with special needs don't bite. They're capable of doing it, but they're doing it for a reason, and we need to help them. And I know you guys are probably tired as all get out. You can't, I'm sure a lot of you've worked hard before or have had another child prior to having the special child. There's a tired that comes. I think that's why I can pull off as much as I do now. There's a tired that comes that I don't think anybody with a special child, other than us, that we have, we're groupies. No, you can't explain that. This is not staying up 3 days solving a math problem. You know what I mean? That you have to do for your dissertation. This is a different game, and you need help. And I'm just trying to offer my little bit. But right now, unless I can't get my hands on you, kind of thing, it's just verbal. But hopefully, these little tidbits is just enough. Even if I'm just helping one person, my day's brighter. So please, I'm just trying to help you, and it might take a couple of opinions. With me, it took 26 opinions, 4 ears and nose and throats. When I start going through our medical list, I feel like I'm singing a partridge on a pear tree. It's like 1 endocrinologist, 2 gastros, 3. And again, I don't mean to make light of this situation. I think also too, special parents have a really warped sense of humor. I certainly do, and that's just I guess coping mechanisms, and it's okay. I just didn't. I planned my nervous breakdown. It was supposed to happen when Graham was around 12. I said it was 10 years out, then it was 9 years out, and I'm like, I'm disappearing for a week. I didn't end up having to do it. By that time I got busy with movement lesson. But anyway, I hope this helps. Please, other than a boo-boo, kids shouldn't be crying. It's not neurological. It can be reflux. It can be sinus. It could be all sorts of things going on. But really, if you have a transitioning issue that your child just has to fall asleep on your chest, just have to, I'm sure a little bit is a little spoil and love, but that's not why they're doing it. Kids do need that independence. And you see that if you have a typical child. They like that cuddle, but it's like, bye, I'm going to go do this now. See you. There's an independence that starts with them. And you're like, oh, my baby. And then our munchkins really need that extra. And they do need that extra because some of them are in a lot of pain. So with Graham, it was probably about a good 7 years before I got a complete handle on it. So thanks. See you later.